I think for Singapore, definitely we are all hoping to have achieve that vision where the elderly and the aging population we have a community that is friendly, accessible to them. But I think to achieve that is not so easy because there are many dimensions that need to take place and all the dimensions need to work together. So for us in Singapore, even at different towns, different communities, each will have different dimensions that they're strong in, some dimensions is not up there. So currently, I think we are really at this particular phase. It's not just about the infrastructure, it's not just about the services. You also need to have the whole town and the culture to accept and to live together with the elderly who have different requirements. We also need a lot of connecting elements to it. So currently, I would say we are in a phase where we have different dimensions are coming in. So I think the different challenges are at this moment surfacing up. But I think if we were to press on, of course, this is something we want to hope for, where all our elderly can live a good life in the community and age gracefully. This is a very interesting topic because if we were to be guided by the directions of the government, then we every year we hear slightly different positioning. Not too long ago, the only thing I could remember hearing was the regional cluster, regional health system. More lately, we are talking about aging in place. I guess at the end of the day, like the earlier question, I think for the healthcare delivery system to be part and parcel of these integrated services, I think you need all elements. So I think basically we are now in a phase where we are putting all the different dimensions, specific for healthcare, into place. And I don't think each one is more important than the other. So I think the key really challenge is then how do we integrate them, like what you have asked, and also to ask a question, what does integration means? Whether the integration means that it's a system where the different providers can shake hands and serve the elderly in a seamless way. Whether we are talking about the patient themselves or the elderly can move through the system in a seamless way. So all these are actually, I would say, on the table at this moment for discussion. I'm no wiser. Everybody would have their view of what constitutes integrated care. But in this particular forum, for me and for my organization, our view is slightly different. Our view is that currently we feel the community care services are just too fragmented. And there are just too many, in the social circle we use the word, too many helping hands, whereby there are just too many hands, not coordinated, neither is it necessarily achieving the outcome. So for my organization, Kwong Hospital, we are in a redevelopment phase. So we believe that we have an opportunity, and that's why our vision for these integrated services for ourselves is actually to build an integrated nursing home and community hub, whereby we put all the suite of services, healthcare services for the community in one location, and we are very clear who we are serving. We are serving the Whampoa, Kallang area. And then what we need to do, therefore, is to put in the necessary logistic coordination care such that the community that I have mentioned can then make use of the hub. On top of that, we are looking at also clinical element to develop case management so that the elderly living here can do that. More recently, we are very excited whereby the Whampoa and Kallang hub area will be the first pilot for the aging hub. It's a new program, and so for us in our hospital, we are very clear that will create a very good opportunity for us to even reach deeper into the community. So we hope that we can get a bid for this, and then we can create this concept of hub and spoke. So we are very clear about this dimension about integrated services. You really need to have a big provider. You need to then have the provider that can provide the whole integration. The current fragmented approach may not necessarily be the best way forward.